So hello and welcome everyone to the next episode of the AHP Preceptorship podcast. We are joined by Kaego today, who I will get to properly introduce herself in a second, but just welcome back. Obviously you know who we are, but if you're new here, I'm Hannah. I'm one of the Preceptorship podcast leads and I'm a physio by background.
And I'm Felicity and I'm a podiatrist by background.
So, Kaego, it'd be really nice if you could obviously properly introduce yourself, your profession, and maybe where and when you qualified.
Yeah, thank you. So I'm Kaego. I'm a dietitian. I qualified from University of Nottingham in 2021. And I was working in the private sector beforehand, but now I work in an NHS setting.
Fab. So we always love to hear stories as to how people, got onto the path of becoming an AHP. We'd love to hear, how did you become an AHP?
Yeah, so I've always sort of liked food and health, and I knew I wanted to work in a career that was helping people. So I knew it would be something hospital based, but I didn't really know what. I hadn't heard of dietetics, and I feel like it's not that well known even now. So I was initially looking at food science or something like maybe just nutrition and food science, some sort of mix like that. So I was just doing lots of Googling, lots of searching, and then I stumbled across dietetics, and I thought this is perfect, just everything I wanted, food and helping people. I just thought that seems like the best option. So yeah, that's how I got into it.
It's funny, isn't it? A lot of AHPs kind of say they always stumble into it. They're not so well known. So it's usually when you take a deeper dive, or
you maybe have a passion in something, or you may have had treatment from that AHP yourself, maybe. But yeah, I didn't know very much about dietetics until I actually started working in the preceptorship role. I feel like the profession isn't as well known because even though I'd worked with dietitians before, it was on a really brief basis. So it's really interesting, the journey that led you there was the caring and the interest in the kind of food science as well.
And I love how you said it all kind of fell into place. Yeah. It was like that meant to be moment.
Yeah, exactly. Yeah.
You find the right fit.
Yeah.
So obviously I know you said that you worked in the private sector before. Could you maybe talk about your first post, after qualifying?
Yes, I worked for a private weight management company, so it was just supporting people to try and lose weight, and if they had type 2 diabetes or high blood pressure, just to help them sort of make healthy behaviour changes. And that was it was a very different role to my current role now, because that role was fully remote, so I was working from home. It was just you and your laptop sort of getting on with it. It was very different. It's very different to working in the hospital setting, but I still really enjoyed it, and I do really enjoy weight management and sort of behaviour change and that side of things, but I thought it would be good to just sort of make the change and have some clinical experience.
And did you kind of have any support in form of a preceptorship when you worked in the private sector? Because obviously working fully remote, your kind of feelings around support must have been really different to maybe obviously working where you are now, where you're surrounded by an MDT.
Yeah, so in my first role, there wasn't any sort of preceptorship or any sort. There was support, your manager was always there for sort of one-to-ones, things like that, but there wasn't anything like preceptorship. And I had heard of it towards the end of uni. They did mention preceptorship, and I was thinking, if I was to get a band 5 NHS role, I was thinking the trust I would work for would have that sort of program, but I don't think that's sort of carried through in the private sector or anything that's not NHS based. There wasn't any sort of preceptorship program. We did have a buddy system where there was more experienced colleagues could sort of partner with a newer member of the team. So I guess you still had support, but it wasn't the same as this sort of program.
And how were you feeling when you went into that first role? Were you feeling a bit of imposter syndrome, or were you no, I'm ready to go for it, I've done 3 years.
Watch out, well.
Yeah.
No, I think there was definitely some imposter syndrome and some just do I know what I'm doing? Am I actually am I ready to just go out and start telling people how to lose weight? Or I feel like you always have a bit of nervousness before you start any new role, because you're just am I in the right place? Is it me they hired? So you always have those sort of questions is this the right thing? But it was the team was really supportive. Everyone was so lovely. So it was a really nice place to work.
And then kind of on the flip side of that, how were your feelings when you came and started working in the acute setting, when you got your first NHS job? How did your emotions maybe vary, or were they very similar?
It was kind of similar in the sense that I had imposter syndrome again.
Follows you everywhere.
Just because this role is obviously really different to rate management in the private sector. So this was a new sort of, obviously I know what I'm doing, but it was just a bit of nerves because I was thinking, I haven't done anything clinical since my placements when I was a student at uni, and that would have been like a year and a half. I was doing rate management, so I did have a bit of a gap between sort of my clinical placements and then this clinical role. So I was, a bit nervous that I would have like forgotten stuff or I wouldn't be too sure. So yeah, there was that little bit of nerves as well.
Yeah, because you are going through a whole new transition, aren't you? So what would you say like your main challenges were when you came into the NHS, and just talking through like how you combated those challenges?
Yeah, I think it was just getting used to, first of all, coming into the office 5 days a week.
You're right, though, that is a challenge, from working remote.
Yeah. My role was fully remote. It wasn't like hybrid or anything, so I was just always at home, and then having to come here every day, and I think that was the first sort of initial challenge, but I guess you just sort of get used to it quickly. You just sort of pick up on everything. And I think another challenge was just, again, having, I guess, a different patient group, because the previous, the weight management role, the patients were generally sort of well, apart from obviously being overweight or having type 2 diabetes, whereas in this setting, the patients, they might come in with something, but they will have lots of other sort of health conditions as well, and it's just a bit more complex, I would say, the patients that you're dealing with, and I guess they are acutely unwell because they're in a hospital. So I think just dealing with sort of the differences in the patients, and the role is quite different in what you're doing with them again.
Absolutely, it's kind of those emotional boundaries as well when you work in an acute setting and trying to navigate that. And like you said, I'm sure there's lots of things that you see that maybe you go home and you think about, and you might get upset about. So yeah, really important that I know here you have a really supportive environment, don't you? You've got a great team around you and great leadership as well, and a great therapies department. So I'm sure that was something that really helped you combat those tough days and those really challenging patients, because that's what gets you through, really, your team, doesn't it?
Yeah, exactly. Yeah. Everyone here is so supportive, and so like everyone's just happy to chat to you about anything, and it feels like a really nice sort of space that you can say if something is sort of bothering you, or if there was a difficult patient, you can always go back to the office and just talk to someone about it. So yeah, it is really a really nice environment.
We always say when we walk into this hospital in particular that it feels really like family based. It is like got a cozy feel when you walk in. Yeah. It has that good mix of, it's a clinical setting, but actually it feels really welcoming. So I can get that. I think even just from the like environment, you pick up that it has a really supportive vibe. So obviously other forms of support besides for your team is that you were offered preceptorship when you came here, and something that's been recognised now by the national framework is that it doesn't have to be your first role after qualifying for you to need preceptorship. And actually we face transitions throughout our career. And obviously one of yours was that you'd worked in this remote private setting before your NHS job. So you'd had some experience outside of the NHS. So I know that we obviously adapted the programme to meet your needs, and we just kind of did half of the portfolio, but you still had full access to the support and the meetings. From that, how we adapted it, and from your access to preceptorship, what do you feel like the main benefits of preceptorship were for you, especially as somebody who wasn't brand newly qualified?
Yeah, I think preceptorship was still really helpful for me because, as I said, I did have a little bit of like imposter syndrome coming into this new role because I was out of clinical for a bit of time. So I think it was really useful just to sort of reinforce my confidence and make me feel like, I know what I'm doing and what I was doing. Some of the things I was doing, my daily role would count as evidence towards the preceptorship portfolio. So it felt as if like, I'm doing everything right and I know what I'm doing. And I think it was just a really good support system, especially the meetings that we had where we got to go into the breakout rooms and sort of meet with the other preceptors as well. I think that was quite helpful just to see what other people are doing and, share ideas. And I think it was just a really helpful experience to sort of settle into this new role.
Absolutely, yeah, and we're really glad the national team have recognised that, because we had kind of noticed that it's not just newly qualified that go through, imposter syndrome when you do transition, and our programme, offers those adaptations, and it's great that we could offer you just the 12-month competencies, and you speak, when we signed you off, you were speaking about certain competencies that you're really proud of, and in particular your quality improvement. And was that because of the competencies in the portfolio that you were like, right, I'm going to look at quality improvement and look at, how I could look at service development?
Yeah, well, it was actually something, one of my colleagues was he initially floated the idea already, and I thought, it would be good for me to get involved in something like that, and it would count for preceptorship as well. So I thought it's something that I thought was a good idea that we should have brought forward, and it also counted towards preceptorship. So I thought it was sort of a good, killed two birds with one stone almost. But yeah.
But it's nice because I think sometimes with preceptorship, people do float these ideas, and it's nice because you thought, that's a really good idea, and it would provide evidence. I think it sometimes can support people into committing to doing something, whereas maybe they may be like, I'm not sure.
Like stepping outside your comfort zone. Oh no, this isn't my portfolio, so I can do it.
Get those skills that we are all absolutely developed for, but sometimes we just need something to kind of push us into it.
A little push,
And you also reflected about the observed practice. How did you find that beneficial?
Yeah, I thought it was so useful because even though you do feel a bit like a student having someone watching you, I think it is really useful to get the feedback from someone, positive feedback, negative feedback. It's just good to sort of hear that, what you're doing well and what you need to continue doing, and then sort of little things that you could tweak or you could add on. So I did find it really useful to have that, even though it was nerve-wracking having someone watching you. But I think it's really useful because you don't normally get that feedback in your sort of day-to-day work, and especially as dietitians, we're quite independent, so we tend to go to the wards by ourselves. We don't tend to sort of do joint assessments with other dietitians like other professionals might do. So it is quite useful to have someone sort of with you and sort of seeing how you get on. Yeah,
you're right. It can feel unfamiliar, can't it, to have somebody watching you sometimes, but I think it's those things that maybe you don't pick up on yourself, your body language or your rapport. When you get feedback on that, it's really nice because it gives you, as you said, those pointers of things that, maybe you would do differently. But also for the person observing you, they might pick something up as well as you picking something up. So it's like a nice peer kind of supportive.
Yeah, you might have a nugget of knowledge from uni that you've just learned, and you can, showcase that to your colleagues. Lovely. So what would you say overall was your favourite aspect of preceptorship?
Oh, that's quite tough actually. Because I did really enjoy having the observed clinical practice. I think that was really useful, and then as I said, the meetings as well were really useful, meeting with the other preceptors. So it's quite tough to pick just one, to pick my top one out of those. I guess I would say my favourite aspect would have been the clinical practice, being that observed, even though, as I said, it was quite nerve-wracking. I think it's just really useful to get that sort of feedback because we don't tend to get that often unless it's your sort of annual review or appraisal or something like that. So I think it was really beneficial to get that, and it's something that I would want to continue sort of going forward, just to have someone, even if it's once every so often, just to have someone just observe me and we can discuss it afterwards and just see anything else I could improve or what's going well.
I was going to ask you if that was something you wanted to instill in practice, because when I first qualified, my every other supervision session for me, I had somebody observing me. And then I remember when I then got to a band 7, I had no one observing me, and I actually missed that. I had it as a band 5, I had it as a band 6, and as a band 7 I was like, no, I still really want this. Because I'd been so familiar with it and that shared feedback. So I'm really glad that you found it useful, because as you said, it can be daunting sometimes, because somebody's watching me. But it's such a useful learning experience, and I think it's something so good to just be familiar and comfortable with, because you never know when somebody's going to observe you. It could be the CQC. They might pop along.
Absolutely.
You never know.
Yeah, and I think it is important for those smaller professions where we do work in silo, because I'm a podiatrist and there isn't many of us either, and working in the community, we're always out by ourselves. Clinics usually by ourselves, like one chair clinic. So we also had, as part of our team, peer reviews every year. So I always learned so much from them. So yeah, I'm glad that's kind of really had a really positive impact, and you've got to carry on with that. I think that will be great for when you start supporting others.
Yeah, that's true.
Yeah, because you can be like, hey, let's incorporate some observed practice. I really benefited from this, so that has a really positive, I guess, impact on your whole team.
Yeah, that's true.
And love that you're kind of other choice was the meetings with the networking, because as you say, you know, you've touched on with the observed practice, when you work as, you know, quite autonomous and, you know, not maybe working as closely with, as in joint assessments with other members of the MDT, it's really nice that you can then hear their experience. So, you know, that imposter syndrome, you're not on your own, and you do get the chance to network, which I think is invaluable, really, when you can hear that other people are having really similar emotions as yourself as well. So I'm glad that made a very close second. So we always like to hear, would you recommend preceptorship to another, AHP, maybe, or not newly qualified necessarily? There could be somebody who, you know, is in a similar circumstance to you. Would you, you know, encourage people to go and look at preceptorship, or if they're on a preceptorship, you know, really engage in that programme?
Yeah, definitely. I think it really just instills your confidence and makes you sort of feel more like, you know what you're doing and you're able to do your role. And even if, you know, you're not sort of newly qualified and you're similar to me and you've done something else, I think it still is so useful just to sort of, as I said, reinforce that, you know, you are a competent practitioner and you can do your role properly and sort of efficiently. So I feel like it is still really useful to get that. And then with the meetings as well, you get to network with other people. I think that's always useful as a professional, to always network with other people, even if it's not other dietitians, other, you know, the rest of the MDT that we'll be working with. So I think it is a really useful experience.
And just continue on from that. You actually were on our meeting last week as a preceptorship buddy, sharing your top tips. But for the podcast as well, what are your top tips for anyone that's maybe starting out with preceptorship or within their first post?
I think to starting preceptorship, I would say just to try and set aside some time for it, like as regularly as you can. For me, what I found most helpful was to set aside 30 minutes each week. I thought that was the most that would work the best for me. And I guess obviously everyone's caseloads are different, everyone has different schedules, but I think just trying to be quite strict with that projected time, so you just have, you know, that each week you're working towards something and you have sort of something in mind that you're going to do in your 30 minutes. I think that's quite helpful. So I would always try and like sort of mentally plan a few competencies that I wanted to sort of aim for or get evidence for, and that would be like my weekly sort of tasks. I think that's quite useful. And then in terms of, you know, like new tips for if you're starting a new role, I would say to just, you know, if you are sort of unsure about something or you're not quite confident doing something, I think it's always just important to ask for help and ask for support. And I think sometimes it can be, you might feel a bit nervous about asking for help because you don't want to look as if you're not sure of what you're doing, but I think it is really important to recognise when you need just a helping hand, and there's nothing wrong with that. And I think especially if you have a team that's really supportive as well, they'll be happy to help you or happy to show you how to do something. So I think asking for help is really, you know, sort of recognising when you need help is really important. I think also another tip I would say is just to enjoy it and just to sort of take in every moment and take any like opportunity that you can anytime, even if it's to shadow like another member of the team or shadow something else happening. I think it's really important to take all the opportunities that you can get, and I feel like especially as a band 5, that's sort of the best time to sort of see everything that you can and learn as much as you can before you go into maybe a more specialist band 6 role. So yeah.
Great top tips.
Yes. And talking of band 6, you're now in your band 6 role.
Congratulations.
Yeah. How are you finding that transition into band 6?
I think it's a big jump because the caseload is quite a bit busier than my previous one. But it's a big learning experience, and I am really enjoying it and seeing like slightly more complex patients and seeing a lot more patients as well and doing different things. So yeah, I am enjoying it. I'm a few weeks in, but yeah, I am really enjoying it.
Oh, huge congratulations.
Yes.
Thank you.
It's so well deserved.
Yeah.
So that's all we have for you in terms of questions. Is there anything else you'd like to add, as you are our first dietitian on the podcast?
I want to say thank you to both of you for being so lovely and so supportive as well throughout the programme, and always with the meetings as well. You always make me laugh with all your jokes.
Hey, we've got a laugh at work.
Yeah.
Oh, that's
Thank
really
you.
sweet.
Thank you.
Yeah, it's nice to know just with those meetings that people are really taking a time away from the busy wards, and it's so nice to hear that even just putting a smile on your face that you can walk out the office just you know, happy and
even if people laugh at us,
yeah, we don't mind that
rather than with us. We encourage it.
Yeah, we try and keep those meetings quite light-hearted and because you are all kind of dealing with your own stresses, and it's important just to, I guess, have a different mindset and just that time away. And hopefully the topics that we discuss are useful, and I think they really do resonate with people. You're going through different stages. Sometimes the meeting can come at just the right time of what someone's going through. I think we had a preceptee before saying, we were talking about prioritisation, delegation. She was like, "Oh, I really needed this today." So that's
and we've
really
had that with control, influence, accept before as well, where people have been just having a kind of a difficult task, and then we go through, we call it CIA, so the control, influence, accept model, and people have then emailed us after going, I didn't realise I needed that until it happened. So it's fortuitous when that happens.
Well, thank you for coming on and chatting with us. Obviously Kaego is one of our preceptorship buddies. Especially if you are a dietitian, please do reach out if you have any questions. And thank you so much.
Thank you for having me. Thank you.